Hello everyone. I am Dr. Raghaendra Kosski, consultant microsurgical andrologist and urologist and sexual medicine specialist from Apollo Hospitals, Jubilee Hills, Hyderabad. Let me discuss about the phimosis, which is a quite common reason in many individuals from their childhood to their adulthood. Basically, what is phimosis? Phimosis is nothing but on the head of the penis. What we call it is a glans penis. The foreskin, usually it comes back easily. If are you facing any difficulty in retracting the prepuce back onto the head of the penis, that is glans, we call it as a phimosis. So basically, it is a difficulty in retracting the preputial skin or head of the skin back to the head. So that is a phimosis. There is a physiological phimosis. That means for the children, because of the adhesions, this physiological phimosis may be there up to 4 to 5 years of age group. Slowly after that, the adhesions will release and it will become normal. If still it is there, it will be we call it as a regular pathological phimosis. So where it is common, this phimosis is quite common in individuals with diabetes. Especially India being a diabetic capital, many patients will get fungal infections. What we call it is a balanoposthitis, where there is an infection of the head of the penis as well as the preputial skin. Slowly that will lead to tight foreskin. So chronic balanoposthitis is a common condition which leads to phimosis. In some individuals, the childhood phimosis will remain like that. That is a congenital phimosis, but it will continue in some individuals because of some injury or trauma that lead to phimosis. There is another condition called a chronic inflammatory condition, what called as a BXO, Balanitis Xerotica Obliterans, which may lead to a phimosis. In very rarely, some other coital injuries may also cause some issues with leading to the phimosis. So how we can diagnose a case of phimosis? It is simply, there is no further testing is needed. Your doctor will examine you. On examination, if there is a difficulty in retracting the prepuce, that is enough for the diagnosis of the phimosis. There are various grades of the phimosis where there is a mild difficulty will be there. We can retract it, it will form a ring. In the second grade, it comes back and it will cover half of the penis. In third thing, where there is a quite difficulty in retracting the prepuce, only half of the portion. In the fourth scene, completely we cannot withdraw the foreskin. So there are various grades of the phimosis. So whenever some people, they have absolutely normal on examination, but there is a difficulty only during intercourse. Whenever there is an erected penis, it will stuck, and there is a difficulty that where they face a coital pain. So in those individuals also, the next further treatments may be needed. So how we deal with phimosis? In majority of the patients, this phimosis, if it is not treated, because it may lead to a recurrent urinary tract infections, and there will be a chronic discomfort in that area, because all the males behind the foreskin, they'll get a smegma, the white material. Usually they clean themselves if it comes back. If there is a tight foreskin, they cannot clean that smegma, so that it will lead to infections, and very rarely this chronic inflammatory condition may lead to penile cancers. So whenever there is a phimosis, if it is of mild nature, probably people can ignore if they are comfortable. Otherwise, in majority of the patients, phimosis needs to be corrected. So what are the various ways to correct the phimosis? Conventional circumcision, where we can remove the part of the foreskin, that is a sleeve technique, what we call. And the latest advance is usually we can go ahead with the stapler circumcision. So other options that people are on the net, they are searching about the laser circumcision, and there is nothing great about the laser circumcision, where instead of cutting with a knife, only we use the laser, where minor bleeding will be a little bit less. Otherwise, again, we have to suture. So coming to various options, either it is a conventional or sleeve technique, or it is a laser or a stapler circumcision. Cosmetically better reasons and faster recovery with the stapler circumcision. So according to the patient needs, we offer all the services. They can choose whatever they want. Probably if you are facing these issues, you can visit the andrologist or urologist. Thank you.